most people with autoimmune disease think that they are a super special rare zebra, whether that's with their diagnosis or their symptoms or their lack of diagnosis. Hey, everybody, I'm Maggie Yu, MD, functional and holistic medicine physician, and the creator of the Transform Protocol and the program Transform Autoimmune Disease Naturally. We also have a Facebook group by the same name, Transform Autoimmune Disease Naturally. We're at 55,000 strong plus and growing. This is one of the biggest pro-positive Facebook groups on the planet, and it's called Transform Autoimmune Disease Naturally. If you haven't joined it yet, make sure you click the link above or below in the comment section. We'll add it to the comment section as well for you to join if you haven't joined it already. We have a hot topic, which is that interestingly, a lot of people don't realize that most people with autoimmune disease think that they are a super special rare zebra, whether that's with their diagnosis or their symptoms or their lack of diagnosis. In fact, it is the most common scenario of people we talk to is that they think they have a super rare special disease. And with it, you guys don't realize is that it comes with a whole host of obstacles. And actually keeps people from getting better. And Rosanna's here today. She's joining me. Roseanne is our Transform advisor. Our team speaks to a couple hundred people a month. And so one of the feedback, Rosanna and I actually got into a conversation last week was, why is that the most common scenario? And don't people realize that it actually creates a lot of hell or obstacles for them? And why is that the case? So Rosanna was the one who pitched this idea. Why don't we do a Facebook Live on this? So Rosanna, I'd love for you to do a quick introduction.
I'm one of the people that you're going to speak to likely when you give us a call. And the reason why I wanted to bring up this topic is because the majority of people that I speak to about this program are dealing with such an array of symptoms or rare symptoms or combination of symptoms that they really are skeptical and can hardly believe that there's a possibility that they can get some actual turnaround and results.
There is a story, and stories have so much power. And I would love for you to even define, like, we know when we're talking with someone that they think they're a super special rare zebra. What does that story look like or sound like? Can you give us some examples?
Oh, I've tried everything and now I have more problems. Why am I so unique? Why am I so different? Why is nothing working for me?
I'm super special because nothing has worked for me.
Yep.
Okay. I hear it all the time, which is in the Facebook group, we get a post. Does anyone else have CIDP? Does anyone else have X, Y, and Z 0.23? And and I'm always it always kind of baffles me when I see one of those posts. I'm like, who cares if anyone else has it? Don't you want to end it? But at the same time, it's interesting the need for people to say, hey, I have this diagnosis or I have this set of symptoms, and who else has it? I think what's fueling the story is how alone people really feel in their healthcare journey. I think people don't realize, number one, how common autoimmune disease really is. Autoimmune disease is growing at an exponential rate. And it's not just in diagnosis. There's a lot of reasons. There's genetics involved in here. There's environmental stressors. There's dietary issues that are concerned. There are things that are epigenetic things that are turning on genes for autoimmunity. Hormonal shifts, that is huge. So much in an environment, in our diet, in the products we use is really causing huge hormonal shifts. So these hormonal shifts are turning on the genes for autoimmunity. And then we got super infections that are going on, including the big C that we're talking about, that is majorly triggering and turning on autoimmunity for people. So more and more, there's assault on our system that's turning on autoimmunity. So it's becoming one of the most common diagnoses that we deal with. But the problem is, another word is the word diagnosis. Okay. Because here's the thing. I think the diagnosis and the lack thereof is extremely misleading. Because I'm going to ask you, Rosanna, how many people actually we talk to and how many people that join the program have no diagnosis?
Probably about 30% of them.
30%. That's absolutely true. 30% of the people in our programs have no diagnosis, but what they have is a shit ton of mystery symptoms. So if you have, this is me, I'm describing me right now and my symptoms, okay? You had early menopause at 36, you had weight gain, you had postpartum depression, you had hair loss, you have fibromyalgia, you got joint pain, you got tendonitis, you got herniated disc in your back, you got TMJ, and now you got thyroid issues. And then you have menopausal hell on top of it. And then now all of a sudden you have neuropathy. And then now you have Raynaud's and your fingers are going, turning blue in the hot and cold. I'm a super special rare zebra. And I actually want to point something out here. This is the normal way autoimmune disease shows up. I'm actually a normal autoimmune disease sufferer. Okay. Not sufferer, conqueror. Okay. And the reason is this I think, Rosanna, like, even if someone shows up and they say, I have this diagnosis, they always have 10 other symptoms. Or if they don't have a diagnosis, they could have 10, 20, 30 symptoms, and no one can figure out what the diagnosis is. Or they have a diagnosis, but no one can add the additional diagnosis to explain all the other symptoms. So, what are the doctors telling them when this happens? Okay, this is the common autoimmune person coming to us right now. But when these people go to the doctor, what do you hear the doctor tells them?
They can't do anything for them.
We don't know what's wrong with you.
Yep.
You are a super rare zebra. I've never seen somebody like you in my career. And I'm laughing not because I think it's funny, but I want to explain from behind the scenes why the doctors say this. Why do doctors tell you guys this? Okay. It's because there's a total lack of understanding in the medical community about what autoimmune disease really is. Fact check right here. So, autoimmune disease is where your immune system is supposed to protect your body from germs and cancer. Instead of fighting germs and cancer, it's looking at your own body part and says, you're a germ, you're a cancer, I'm going to kill you. Now, if it already mistakes one part of your body as a germ, you have rheumatoid arthritis, it already doesn't like your joints. Guess what? It's going to mistake hundreds or thousands of other body parts as a germ, and it's going to attack those targets. You're not a rheumatoid arthritis case. You're actually someone with autoimmune disease, of which one of the identifiable symptoms has a name of a diagnosis because there happened to be a blood test for that target. But you have 300 other targets that we don't even have a blood test for yet. So you're not about or defined by your rheumatoid arthritis, nor am I defined by Hashimoto's or mixed connective tissue disorder. I actually have an autoimmune condition with which my body's attacking multiple and hundreds of targets of autoimmune attack. So I am not defined, nor are you, by your diagnosis or lack thereof. Behind the scenes in Western medicine, we're trained to look at one symptom, give a fix. One symptom, give a fix. You got heartburn, give you a Prilosec. You got an infection, give you an antibiotic. You got numbness in your finger, let's see what we can do about that finger. But really, for me, there's an underlying bigger issue. Why does this person have numbness in their pinky? They may have something attacking all their nerves throughout their body. That's an autoimmune attack, and it just happens to be showing up in this pinky first. So for me, there's such a bigger issue. And which is why, for me, every single autoimmune patient has very similar things that are feeding it. It's the same condition. It's just that different people have the targets that have certain types of testing that says, oh, you happen to have this one disease identified. But that doesn't mean you don't have a ton of these other symptoms. But the problem is primary care providers, let's say you go to your regular doctor, we got 15 minutes with you. Trust me, I was a primary care provider. And so I'm like, patient Z is coming to me with 30 symptoms. Ain't nobody got time for that. I'll deal with the top three, one, two, three. And then the rest of it is, I've never seen someone like you. I don't know what to do. Let's send you to 6 other specialists. And so it's a circle that people get into, is that the primary care provider doesn't have time to deal with the complexity of these hundreds of targets. So they send you off, farm you out to 20 other specialists who has difficulty giving you a diagnosis because most autoimmune diseases don't have a blood test for that target. And then they also can't help you most of the time because their band-aids don't work to stop the underlying causes. So if they can't diagnose you and they can't really help you, then you're now a super special rare zebra and they don't really want to deal with you. So you're going to be told, well, that's really strange. I don't know what to do with it. Super rare, hundreds of times again. So I don't feel like it's the patient's fault that they feel like they're super special rare. I feel like they're being told that hundreds of times.
They're absolutely being told that. Or they're told they have such a rare autoimmune disorder that they are special. But how does the root cause approach affect or work for everybody?
This is interesting because I'm looking here right now in chat right now. if you believe this is your story that you have been told by your doctors that what you have is really rare, what is the consequence of that story? What is the price you're paying for that story? And I'm interested in with Rosanna, how do they show up? This is 80% of you. So I'm not singling anybody out. And this was me before as well, just so you know. So how do they show up when they talk to us that, can create some barriers to them actually getting help?
It's become their identity.
That's interesting. Can you explain that?
Yeah, that's who they are. They have adopted it as who they are. They've lost their sense of self and now they are their illness. Their vast array of symptoms or unique diagnosis, and they become attached to that story and they learn to live life as that individual.
So if your identity is that I'm a super special rare zebra, the natural conclusion is that I'm alone, number one, and number two, no one can help me. And here's the deal. If you truly believe you're alone and you don't realize that there are millions of you out there, millions of Dr. Maggies out there, if you don't really understand and believe that, and you truly believe you're alone, then it's true. Nobody can help you. If your story and your identity is that you're alone, then yes, nobody can help you. The other thing is, if you believe you have something that's super special and rare, then the natural conclusion is that also my solution must not exist and must be super, super rare as well. So I'm never gonna find the right solution,
And they give up.
and I give up. That is the problem.
I have
Aw.
a very close friend whose husband has already had a liver transplant because of a super rare autoimmune disease of the liver. And it's very hard to get them to understand that it doesn't matter what the diagnosis is, whether it's rare or common, there's still a way to turn it around, the root cause approach. It's such a hard thing for people to understand when they fall into that rare category.
Well, I think what people don't realize is that what is the commonality in all autoimmune diseases is how they're fed. You can take this to the bank, everybody. Please take this to the bank. If you remember nothing else from this life, I want you to remember this. The most common thing about all autoimmune diseases is how they're fed. I know what feeds them. I know how to identify what feeds them, and I know how to stop feeding it. So why does it matter what the diagnosis is? Just stop the fire hose that's feeding it. Like, stop the hose. Like, instead of sitting here saying, like, "Oh, there's water in this room, and this room, and this room, and this room. We gotta go and suck the water out of this room, that room, that room. We gotta get, people to restore this home here and there and all this stuff." I'm like, "Can we just turn out the fire hose?" That's like pouring this 1,000 gallons of water into your home every single minute. Can we just go stop the fire hose? Because I know exactly where the fire hose is. I know how to identify the fire hose. I know how to stop it. Why can't we just do that? Does that make sense? I mean, I'm wondering, like, is this resonating with anybody out there? Who wants to know, like, what is the fire hose that's feeding their autoimmune disease and to just stop it? I have Karen right here says, I don't want to see another 1,000 specialists and feel worse. Hey, here's the deal. Like, I agree with Karen. If you saw those 1,000 specialists and it fixed the problem, that's great. You don't need me, right? But if you're going to spend all the time, money, and suffering, and more time with autoimmune disease with permanent damage, just waiting for help from these thousands of specialists, and it's not working, that is the most painful, excruciating, and expensive thing that you can do because you're robbing yourself of quality of life, right? So that's really a good point. And so, like, I wanted to bring this up because I'm curious. Like right now, I'm truly curious how many of you think that you're super special rare zebra. Type in your diagnosis or your list of symptoms.
I think what people also need to understand is that you need to work with someone who understands autoimmune disease and you need a comprehensive approach. I think those are two unique identifying factors that you bring to the table.
I think here's the thing. A lot of people ask me, like, "Uh, who's your doctor?" I don't have a doctor. And the reason I don't have a doctor is I haven't met another doctor who really have lived through, got training, understood, and really teach about autoimmunity. And it's not a pride thing. I'm not proud of this. I wish there was hundreds of doctors that I can say are autoimmune specialists who can help me or help you. There isn't. I had to, I mean, literally, I had to live through my own hell and nearly die 3 times to really, commit to my own training, to saving my own life, and then now to teaching it to others, right? It is by blood, sweat, tears, and investment that I actually had to invest in myself and my own training to be able to survive this and then to be able to share this information. But the problem is, here's what I see. I think there's a big problem with, we already talked about the problem with conventional approach to autoimmune disease, but I also think there's a big problem with the naturopath and functional medicine approach as well. So I'll be honest with you guys, right? I went into functional medicine before functional medicine existed. I'm older than you guys think. I've been in practice 26 years. I'm in my 50s. And wow, did I just say that? Okay, early 50s, all right? God. And what I found was, I had to learn early when there was no Institute for Functional Medicine. I had to learn from naturopaths, functional doctor conferences, trainings, and all that. A lot about autoimmunity. I had to practice it. And I was in medical practice when official training didn't even exist, and I had a lot of practice over the first 12 years of my practice, family medicine doctor. Last 14 years of my practice, I'm a functional doctor because I had no choice. I had to like save my own life, right? But as training has improved, right? I got a lot of experience, real life experience, and on myself, right? But as training has improved, now we're seeing formal training programs of functional medicine doctors or naturopaths, like the Institute of Functional Medicine, right? But what I see is this: doctors, let's say an ER doc says, I'm sick and now I want to go into functional medicine, but they've been an ER doc their whole life. Or I know someone who's an acupuncturist who says, now I want to go into functional medicine, right? So they go to train in functional medicine. It's, from, a couple year accreditation process, which I am accredited in as well. But this is what I found when I was there, was that there is so much in functional medicine. Like, think about the 5 pillars of autoimmune disease that I talk about in my training. I mean, we're talking hormones mastery, blood sugar mastery, gut healing mastery, vitamin mineral density. We even talk about personal growth and mindset work. I mean, if you guys really want to know what's feeding your autoimmune disease and you want information on the 5 pillars protocol I created, put 5 pillars in the comment section and write your diagnosis or symptoms down. And our team can reach out to you and give you the training about what feeds it. But when I look at these 5 areas, Rosanna, and from behind the scenes, this is huge. Let's say you worked in ER for 20 years and now you want to go into functional medicine. It will take you the next 10, 20 years of your life to learn everything you need to cover everything that's needed that fuels autoimmune disease. Isn't just one thing. So what we find is functional naturopaths will go and specialize in one little area. So you'll have a naturopath or functional doctor says, all I do is Lyme, all I do is mold, all I do is hormones, all I do is this, all I do is that. So it's like one little thing. So then the problem is we got super special rare zebra with autoimmune disease that have all these areas that are wrong, right? So there's a lot of content to cover, and there's also a specific order that needs to be done to get to really hack this case. It's not just what you have to do, it's the order with which you do it. And I talk about it in the 5 pillars training, right? Well, then they go to a natural doctor and says, I'm going to go to a natural doctor. Okay. But do you know that it's very rare to find a natural doctor who's going to know all these areas on how to master them, do it in the right order, or even teach you anything about it? So you might go and you didn't realize, oh, I'm actually seeing a mold specialist and everything that they do is just mold. Well, that might be 1% of what's going on with you, but then you're going to see a natural doctor is supposed to have more solutions, but they're only a little sliver. And most natural doctors and functional doctors only focus on one sliver because it's very hard to be good at everything. This is also why medical doctors specialize so much. Do you know it's easier to be a specialist in one area than to be a generalist like a primary care doctor? It's actually harder to be someone who's supposed to be good at most things. And we have that same problem in functional and natural medicine. There's literally no primary care provider of functional medicine that is good at 90% of what's good in functional medicine. There's basically thousands of functional doctors that are really good at one little thing because it's easier. And unfortunately, that doesn't solve the fire hose and hoses that's feeding autoimmune disease. I hope you guys have found this helpful, everybody. So this week, we really did go into why there are so many super special rare zebras. And really, the most important thing that you can take away from this is to turn off the fire hose that's feeding it. And if you want to know how to do that, we have a 5 pillars training where I go through exactly the 5 areas that's needed to stop feeding any autoimmune symptom, period. So you can put in your symptoms here, check your message request later. You can even put 5 pillars in our comment section, and we're happy to share those resources with you guys.